brought here today. Can you tell me a little bit about yourself? What's your name?
My name is Kimberly Matthews.
Kimberly. Okay, nice to meet you, Kimberly. How are you doing today?
Doing.
Okay. Can you tell me why you were brought in today?
Just not having a place to stay, living out at on the side of the 7-Eleven.
Okay.
Mm-hmm.
How long were you at that 7-Eleven?
Been there about 6 months.
6 months? Okay. And then is this the first time that you've had any incident with the police?
No.
No? Okay. When were those other times?
I don't remember. It's been a long time.
Okay.
Kind of off and on.
Okay, no problem. Was there anything you were just kind of staying there and they picked you off?
Yeah, because the people in the store, they want us to move away from their store.
Okay.
You know, I do little jobs for money, you know, pump gas and stuff like that. Just to try to, you know, get a little something to change in my pocket. They had a problem with that. And I have a drug problem.
What do you typically use?
Crack cocaine.
Okay. How long have you been using that?
20-something years.
20-something years. Okay. How often would you say that would
Daily,
be?
all day.
Daily use? Okay.
Mm-hmm.
Would that be multiple times, one time a day? What does that look like for you?
That looked like all day. Like
all day? Okay.
As soon as I can get one.
Okay.
And it's an ongoing thing all day, literally, till I can't get nothing else.
Okay, well, we would love to work with you on some of those issues, and if you're willing, this is kind of a treatment center, but we also provide substance use help as well. It's a completely voluntary program, so while it is a place you can stay, get some rest, get your feet up from yourself and everything like that, completely voluntary, so after the police leave, if you want to head out, you can. So I just want to kind of ask a little bit more about kind of your living arrangement and everything. How long were you, so before the 7-Eleven, how long were you, or where were you at?
I was just, had a tent, I was on the bridge. I've been moving around a lot. It's kind of like they're starting to make us move.
Okay.
Like cleaning up different areas they don't want us to stay.
So who is the us that you're referring to? Or who is the them that you're referring
to? The them, whoever it is that keep making us move. Okay,
is that like
it's
police?
Like
or is
police, land, people, property owners. They starting to clear, you know, we're on other people's property. You know, so they're getting fined for that. Okay. You know, and so we have to move.
Okay. So all the business owners and police people. Okay. Have there been any incidents with the police or with business owners that have just been very hostile and they've kind of been okay? Yeah,
that's like they I don't know if they just hate doing what they doing or they hate us.
Okay.
Because they treat us bad.
Well, I'm really sorry that they were pushing that horrible treatment towards y'all. But I can assure you here, we work with the police, but we're not the police. So this is a safe place for you to kind of get back up. We want to make sure that you feel comfortable and you feel safe. But we're not officers. We're here to provide help, treatment, and a place for you to stay for a little bit. So I kind of wanted to ask, is there any incidents recently, so in the past week, 2 weeks, that you felt that you were at a risk to yourself, that you may harm yourself or somebody else?
Yeah.
Okay, and which one would that be?
I would say harm myself.
Okay, is there, how often is a feeling like that occurring?
A lot lately.
A lot? Okay.
And the colder it is, and the longer I'm out here. Yeah.
Okay. How would you end up if you were to harm yourself, say? What would that look like to you?
I don't know. At one point, I was up on the bridge, so I thought of throwing myself into oncoming traffic.
Okay. And that was within this past week, before this week?
Before this week.
Okay, okay. Have you had any feelings in this past week, however?
Yeah, just, yeah, I have. I feel better today.
Okay.
But, you know, it kind of come and go when you're out there, it seems hopeless.
Oh, of course. I know what you mean. Well, one of the things that we strive to do here is kind of build that hope and build that foundation. We don't want to push you back onto the streets. We want to find a spot for you to go, a spot for you to grow. kind of something to build you up to get to your next place. Not a temporary place. We want to get you to something eventually permanent to where you can self-sustain, and we can help you with your addiction struggles. We can help you with anything like that. So would you be interested in coming in for treatment, accepting treatment? Okay.
Yes.
So we can we have some nurses on site that can take a look over you. They can do blood pressure, they can do an initial assessment, make sure you're all healthy. I know it's a struggle out there. It's been cold lately, so we want to make sure that you're feeling all right.
Yeah.
So we can do that, and then we can kind of get you started. Love to do some more sessions, kind of the substance use, setting some goals, being able to identify some of those triggers. Is there anything that you have noticed in the past where it makes you use a little bit more?
The depression.
The depression?
Yeah, you know what I'm saying? It's like, this all you gonna get anyway. You know, this is very discouraging. I don't see things changing in my life unless somebody help me get up.
Well, that's what we're here to do, definitely. I know it's a big struggle, so it's hard to do alone, and it's hard to do if nobody's kind of back in your corner. But that's one of the things that we want to do here.
Most definitely.
Push, fight for you in the back of your corner. So we're definitely here to do that. So what are some of your goals with the treatment?
Right now, I mean, I don't really, I guess, have no goals right now. I mean, when I do, but I don't. You know what I'm saying? I don't know what to expect, so it's kind of hard for me to set a goal for it because I don't know. I'm right now. I just want to make it through the next 24 hours.
Oh, definitely.
That's my goal. You know, that's it. Just hold on 24 more hours.
All right. Well, we're definitely down to help you out with all this.
Okay.
So we can get you seeing the nurse, and then we can